So veneers are a full coverage over the front surface of the tooth, and they can be made from composite or porcelain. Composite bonding or edge bonding is usually when we're trying to make a few little minor tweaks to the teeth, so they're not covering the full front of the tooth. So veneers can completely change the shape, shade, and length of the teeth, whereas composite bonding, we're just making a few little tweaks to maybe some chipped edges or rough areas, really. Composite is handcrafted in the practice using different layers of different shades of composite to try and make it look natural. Composite is usually done in one appointment and then potentially a following appointment just to polish it up. It lasts about 3 to 7 years, whereas porcelain lasts a lot longer. It lasts between 12 and maybe even 20, maybe even beyond that. So between 12 and 20 years. It's a lab-made material, so it's a lot more highly polished, smoother, and a firmer, longer-lasting material, which is less prone to staining. Composite is more of a matte finish. It's rougher and tends to stain up quicker. Most people are, but you need to have healthy teeth, healthy gums, relatively straight teeth, and no severe clenching or grinding habits. I think if those things are set, and those things would be assessed by your dentist prior to having any of those treatments carried out. For both, you'd need one assessment appointment. Sometimes we like to make a trial smile for either of them. So we get the lab to fabricate or make a little putty that you can try in and see what the final look is going to be before we remove any tooth structure away for both porcelain veneers and composite. So we can do a trial smile, then there's a prep appointment and a fit appointment for veneers. So in total for veneers, you're talking 3 to 4 appointments. For composite bonding, you're maybe talking 2 appointments. If we have to prepare the teeth, there may be some mild sensitivity for the following days, but that should pass very, very quickly. So and during the procedure, you shouldn't feel anything at all. For veneers and bonding, it's really important that you see the hygienist regularly, every 6 months, I'd say. You need to make sure you're looking after your teeth and gums by flossing and brushing daily. For composite in particular, you're wanting to avoid your coffee, red wine, things that can stain your teeth. I guess the key things are flossing every day, brushing it every day, and seeing the hygienist every 6 months. Sometimes it depends how you feel after your teeth have straightened and depends how they look after that point. Sometimes a little bit of bonding or veneers can really help put those finishing touches on a smile. Yeah, your teeth need to be healthy. You need to have enough enamel for both those procedures. They need to be relatively straight, and if you're a severe clencher or grinder, there's more chance your veneers and composite will chip or crack and fracture. So it's not necessarily, it can't be done, there's just a little bit more risk involved on the longevity of those restorations. Very rarely, if a veneer chips, the tooth is actually weakened. It can usually be repaired or replaced. It depends on the severity of the break. Composite bonding can be quite easily replaced. A veneer, usually we have to remake the veneer if it's a split right down the middle.